I had another patient who they live out in the country and they have a septic system. And so they're getting the septic system serviced and, the guy comes out to service it. And as he's leaving, the guy mentions to the husband, he goes, well, you guys sure like to take vitamins, don't you? And the husband goes, yeah, but
how do you know
that? And he goes, oh, come over here. So he opens up the septic tank, shines a flashlight in there. And the husband was like, there's just capsules the tablets just floating on the top of their septic tank. And so he was like, I'm literally flushing money
down the toilet.
Welcome to the PHW Podcast. I'm very excited to have Dr. Marvin back with us. My name is Dr. Jeffrey Davis. And tonight it's episode 12. So we're going to be talking about all things supplements, something that's an important tool that we use in our practice. And I think it's going to be really interesting. We've been looking forward to having this conversation for a while. So Dr. Marvin, thanks for joining us.
Thanks for having me back.
Yeah, I think you were the host last time, so we get to switch places. So this will be a fun conversation. Oftentimes we use supplements and medications interchangeably. So what are some ways where you try to frame maybe that supplements might be different from a medication?
The biggest differentiation for me is like supplements are typically supportive to the system, right? Even with like, not just with frank nutritional deficiencies, but even how we will sometimes use certain herbal substances like ashwagandha has some pretty good research behind it and how it seems to help parts of our endocrine system like the adrenal glands and the thyroid gland work more optimally.
Yeah.
So it doesn't turn them off. It doesn't technically turn them on totally. It might help with just their normal processes of like making hormones, for example, right?
Yeah.
So whereas like with the medication, like thyroid's a great example here where it's like, okay, we could use, in certain circumstances, if a patient's thyroid, labs come back showing that maybe those hormone levels aren't quite optimal and it matches with their symptoms. Of course, again, like after addressing all the lifestyle pieces, we might say, hey, here's an additional tool we can also use to try to help nourish and strengthen the gland so that the hormone production looks better. The hormone conversion looks more efficient, right? Whereas like with a medication, we're just giving the thyroid hormone, right? So that in that place, or in that example, you really are replacing function. And again, to clarify for everybody listening, I'm not saying that's a bad thing. I'm just saying like that's a difference. It's a difference. And sometimes both options are necessary.
I mean, you're bringing up deficiencies. I mean, iodine deficiency has been described in like ancient literature. Probably before they knew what iodine was. And so, and we know that there are parts of the United States where iodine is just not found in the groundwater. They call it the iodine deficiency belt. And, there are profound effects of iodine deficiency on the body. Now, fortunately in the United States, we have iodinated salt, but I will say as people are moving to some of these fancier salts, like, the Redmond sea salt or the Himalayan salts, I sometimes wonder, are we going to see some of that iodine deficiency creep back in that maybe we didn't? Are we going to see goiters start coming back because we're not doing the Morton's iodized salt? Because so what you mentioned the research behind this, and I often hear a lot of physicians will tell me, well, there's no research to support using supplements.
Well, if they say that literally, then I'm sorry, you're just not like maybe searching the correct term on PubMed. There is a lot of research. And I mean, now
thousands and thousands of papers.
We can get into the weeds about, what's considered good research. And that stuff is important. Sure. And I do think we should all continue to hold ourselves to a standard of sorts of like always wanting to be critically thinking through what we're reading and, because we all have biases, right?
Well, and I think we also have to be honest that the amount of money to put into researching whether vitamin C does X, Y, Z is just not there compared to what the pharmaceutical companies can spend on looking at what, a statin does to your cholesterol, right? I mean, there's billions of dollars available for that research because there's billions of dollars to be made on those medications. So, but I would also argue the fact that there are billions of dollars to be made on those medications means that research might not be as reliable because it's heavily influenced by the industry.
Sure.
Right.
Yeah,
I mean, we've all seen studies where they've really massaged the data, done some p-hacking of the variables and you know, I mean, even, you know, the former editor of the New England Journal of Medicine, when she retired, she said, I don't think you can trust any research that's funded by the industry. And it was like a mic drop moment in the community because people realized, well, all of the research is funded by the industry for the most part. So yeah, I hear that a lot, and I think patients also echo it and feel that. But I just challenge people, especially with tools like ChatGPT and Grok. I mean, you can do a lot of research very quickly.
Yeah. Or again, just hop on PubMed.
It's
not hard.
Yeah, type in ascorbic acid.
Hey, with this new administration and NIH, they're making that information way more accessible for people.
Way more accessible.
Where we don't have to pay extra to access certain articles and stuff like that.
Especially stuff that our tax dollars already paid for.
I'm like, hey, we technically already paid for this. But yeah, no, there's absolutely research out there on a variety of, you know, quote unquote supplements or nutrients. But
yeah. So that's probably somebody who just hasn't spent the time to look.
And I mean, again, like no blame to that person. Like there are not enough hours in the day or days in the week or weeks in the year, et cetera, to look at all the literature out there.
Yeah.
So
I would agree.
It's impossible to read everything, but at least, you know, I've learned enough to understand that before I go make a bold claim, I better go check quickly before I say there's an absolute on something.
Yeah, to say there's no research.
Yeah,
I now tell people, I go, I haven't seen any research on that. I feel like that's at least gives me a little bit of a fudge factor because
you can just say I haven't seen that.
Yeah.
To look into that. Mm-hmm.
Well, some other ways. So obviously we use supplements to correct nutritional deficiencies. Vitamin D, like I gave with that patient earlier today, is a great example.
Right.
You were talking about using it to support you know, someone who has maybe a low functioning thyroid. What are some other conditions where you feel like supplements are just really helpful? Yeah. You know, in terms of like prevention. I mean, because again, sometimes maybe somebody doesn't have a deficiency, but they just want to make sure that they don't have that deficiency. Mm-hmm. So might we supplement from a preventative standpoint? Mm-hmm. Are there things that, you know, patients with chronic disease may need unique treatment options?
You know, even if people are on certain medications, we have some tools we can use to check, like, does this certain medication actually deplete or like block the production of a certain nutrient in the body? You know, because there are certain types of like medications like methotrexate, for example, where patients have to take extra folate, you know. Unfortunately, I don't know if we want to get too far into these types of weeds, but, you know, there are different forms of certain nutrients, kind of like what we were talking about, I guess, with vitamin C a little bit, where one form might be better utilized or more easily utilized in the body. So that, you know, of course, always comes when we mention the word folate or methylfolate, you know, stuff like that.
So
but absolutely.
I think you're talking about whether something's bioavailable or not.
Yeah, like how bioavailable is it? Does your body even have to, after it absorbs it, you know, take an extra step or sometimes several steps to actually get that nutrient into a form that can be utilized by your system?
So talk about folic acid, because I think that for me was a big something that I didn't fully understand was when you see something has folate in it. Oftentimes a label will say
folate.
This has it says folate.
But then in parentheses, it almost always says at least part of it or sometimes all of it as folic acid. And again, I you know, again, I've learned, like, don't just because maybe you disagree with parts of something doesn't mean that it's ultimately bad. So I'm not here to say that folic acid is like poison or something. But we have started to learn more and get more information that this specific form of this vitamin, it's technically vitamin B9, right? Folic, if it's listed as folic acid, that many people, probably upwards of at least 50+% of people do have a MTHFR, which is a genetic, you know, variant in their system that just ultimately makes it that much harder for their body to utilize that form of the nutrient. But even maybe for people that don't, because remember, you know, ultimately with the majority of genetic variants in our system, it's not so much about the gene itself as much as it is the like epigenetic or the genetic expression in our environment.
Right. Yeah.
So, I won't sit here and say, oh, folic acid's just terrible for everybody, but it's like, well, it might actually be pretty terrible for somebody who's not methylating very well to begin with because their environment's not great, you know?
So they would have to take that folic acid in their body then before it can be used as a cofactor in one of those many metabolic steps that we have in the human body. They would have to methylate it not once, but 4 times in most cases to get it to a methyl tetrahydrofolate state. Whereas if you took a supplement that had methyl tetrahydrofolate, and my understanding is, so this is again what separates a lot of supplements from other supplements is, if you were to go talk to a manufacturer and say, okay, I would like to custom make a supplement, I want B9, they would ask you, do you want B9 as, what form? Do you want it as folic acid? Okay, well, folic acid is going to cost you, 1 penny.
Yeah.
And it'll be shelf stable for 20 years.
Yeah.
Or we can do methylfolate and it's going to cost you 15 cents per capsule.
Yeah.
And it's going to be stable for about a year.
Yeah.
And so I get it why, so many supplements have folic acid in them, because if you're just looking at the numbers, you're going to say, oh, this is shelf stable.
Yeah.
We don't have to throw any lots away.
Right.
And it's a lot less expensive. And then back then they probably didn't know. I mean, I think when you and I first started, there were no commercially available supplements that you could get outside of a physician's office that had methylfolate in them.
Yeah.
And now, thankfully, I'm actually seeing more and more of those that are what I call the grocery store brands are actually they're cluing into that at some point.
Yeah, I think because the public's demanding it. Yeah. They found that people are taking their dollars and going to another product that does have that form. But that's just one of many examples of some of the things we have to navigate with our patients, right? Where it's like, they might be like, hey, I found this great product. It's got, whatever X number of nutrients in it. And that is a very common one. Some of the B vitamins, like B12, see a lot of cyanocobalamin versus again, a methylated form, which ultimately, to keep it simple, we're just saying there's evidence that shows that the overwhelming majority of people, their body accepts this and utilizes this form much more efficiently, right?
Yeah, I remember when I first started going to functional medicine conferences, and I would go. I was very excited because I'm like, this biochemistry really brought me back to first 2 years in med school, basic sciences, which is something I've always loved, just learning, taking things apart and learning how they work. So it was kind of neat to think, oh man, I can go back in my practice and start utilizing some of these. And I had very lackluster results, and I remember I'd go to the next conference and I would tell somebody, I'm like, oh, this doesn't seem to be working for my patients. And they're like, well, what supplements are you using? I'm like, I don't know. I just tell them to go to Walgreens and get it. And that's exactly the same reaction they had. They were like, no, you can't do that. And then, you start to learn like what separates something, a high quality micronutrient from something that you might get at a grocery store.
Yeah.
And then, so I think it's important for our patients. I mean, we spend a lot of time educating them and helping them understand. I mean, one of the simplest ones I tell people, because they'll ask me, they'll bring in like, well, here's a screenshot of what I take. What do you think of it? And so I try to teach them like, well, let's look at the label. Let me show you some just real quick things that I look at to see if this is something that is high quality from even a manufacturing standpoint. So number one, does it have a lot number on the bottle? And that's a real simple one. If there's no lot number, there's no quality control. Right. So you can automatically say this probably isn't manufactured in a GCMP facility, good manufacturing practices.
Well, maybe we should go into like some of that. Yeah. Let's start with some of the basics, like the foundation, so that people can really understand. Because sometimes I find if I don't with patients in the clinic, they're just kind of like, yeah, I kind of hear what you're saying, but I want to save money.
Right.
So, but I think when we drive home that like, one of the big ways that supplements and drugs are like regulated different, right? In the United States.
Yeah, that's a great point.
So there's kind of like two main institutions that essentially, because right, doctors will also say like, well, supplements aren't regulated. Well, they are, but they technically are regulated differently than pharmaceuticals.
Well, so the FDA, to be a drug, it has to treat a disease or prevent a disease. And so you'll often see on supplements, there's a little phrase at the bottom that says intended to diagnose, treat, or manage a disease.
Yeah. Yep. Yeah. So it's essentially like the FDA, the Food and Drug Administration, and then the FTC, the Federal Trade Commission. Like those are kind of the two big groups that really technically like monitor supplements.
Right.
So essentially like the FDA is kind of there to make sure that these essentially are safe, which I'll go into a little bit more because there are some differences there too. But the FDA is kind of the party that's like, okay, is this supplement really what it says it is? So like, is there quality control? Like, is it what it is on the label? You know, those types of things.
Kind of a consumer protection role of the FDA.
Right. But one of the big differences, it's supplements are categorized more as a food.
Right.
And so with that, unlike a drug, these companies that make the supplements don't have to prove safety before it hits the market. Right. Whereas like with the drug, you have to do all that research and prove, right?
Phase 1, phase 2,
Most
phase 3
of the
clinical
time
trials.
anyways.
Yeah.
No, I'm teasing. We don't go into that. But then what the FTC does is make sure that like the marketing and the claims are, you know, not misleading or like fraudulent, right? Because a lot of stuff will get challenged and pulled because it's like claiming to be this miracle wonder drug. Oh, this will make you lose all the weight, or this will make you like never have dementia or something like that.
Yeah, you could actually argue that is the separating line between something that's a supplement and a drug. Is a drug can make that claim because they can go back to an FDA approved trial that's gone through the trial process, and they were able to show in phase 3.
Yes.
You know, phase 1 is basic safety, you know, but in phase 3 they're showing clinical efficacy for a claim, and they have to have a study for every claim they say. So that might be the dividing line, because there's actually some micronutrients we use that are prescriptions.
Yeah, they are.
Right? I mean, vitamin D is a great example. I mean, that's available as a prescription. Fish oil is available as a prescription.
Technically, vitamin C. Even B12.
Yep.
Some of it, thiamine, it's another B vitamin, B1.
Yeah.
Some of these nutrients are technically recognized as drugs.
Well, and even methylfolate. Deplin's a great example. I mean, that is a vitamin.
Yep.
Yeah.
So that's where like you threw out that term, because this is another important thing to look for, because you can find this on the label of supplements you're purchasing. The good manufacturing practices, right? Or it'll say like the GMPs, I think, right? And there are, like, you can find them. I think they're actually on the FDA's website. It's a list of several things that the company making the product or the supplement has to essentially stand by to claim that they follow these practices. And of course they're like arguably good practices, right? It's all about like quality, purity, you know,
tracing it back if there was a bad batch.
Yeah. So really, like, I promise you listeners that like when you and I are making a specific recommendation for a supplement, it is not because you and I want to make money.
Right.
It's because I want to make sure you're not taking something that's going to hurt you.
Exactly. Or spending money on something that's not going to be effective.
Yeah, right. Because you're right. There is this spectrum of, you know, where a product has been, you know, somebody did some independent testing on it, and this product didn't have all these vitamins and minerals. It had a house plant in it. Right?
Yes.
Like literally
geranium.
Yeah, right. Instead of maybe like the herb or nutrient it claimed to be on the label.
Which is frustrating, because you go back and you go, well, PubMed said this particular herb helps with this particular condition in this subset of patients.
I'm not getting
any
results.
You take it and you're like, it's not working for me. And then, well, they send those in. I think that study you're talking about, there's actually 37 products that were pulled from 4 different stores. So these are retail stores. It was Walgreens, Walmart, CVS and GNC, I believe. And in the herbal products, not one of them had any of the substances that it claimed to have. And it was some variant of a houseplant.
Yeah. And
from genetic testing, they figured that out.
Thankfully, in that type of circumstance, theoretically, that's not usually going to cause significant harm for somebody.
Sure.
But then there are those examples, unfortunately, where like contaminants can be found in some of these products that are, you know, they're being manufactured and made in countries like China, where they have no problem putting toxic metals like lead and mercury in these supplements that you're ordering online because you want to save $1. And meanwhile, you end up with potentially like a heavy metal toxicity, or worse, some kind of end organ damage or something like that. So, you know, that's why we do in the office we ultimately are very intentional about working with companies that oftentimes go above and beyond the good manufacturing practices.
You know, for the benefit of the listener, how do we determine which supplements are we going to bring in-house that we're going to be using? We go through a long multi-step process of figuring that out. But what are some things that we do that you know, can maybe give the patient reassurance that, okay, this is a high quality micronutrient?
Yeah. Well, We definitely only work with companies that are at least going to follow that minimum baseline of those good
So they're all
manufacturing.
GMP
So they're
certified.
all GMP certified.
Some of them have additional certifications like NSF is another certifying body.
Right, exactly.
IFOS is another like fish oil certifying body.
But I think another important indicator along those lines, the companies we work with will do independent third-party quality testing, right?
And what does that mean when you say independent third party?
So the first two parties are going to be obviously the company, right, that's making it.
Sure. So let's say like a Nordic Naturals. Right. It's a good example of a grocery store brand.
Well, and I should clarify, when I say the company that's making it, I kind of meant in that moment, like the company that's actually putting the supplement together, like manufacturing the actual product that like we sell.
Right.
But then the other party in that is the company that provides like the raw nutrient for the company X that we purchase the finished product from. So those are like your first two parties.
Like a multivitamin is a great example.
Yeah.
We get a multivitamin, let's say from a company like Zymogen.
Yeah.
They're going to have to source the vitamin D, the vitamin C, the selenium that's in there, all those things. Those raw materials are going to come from Germany. They might, in the case of like a lot of minerals come from Germany. Germany's highly recognized as like Albion is a great example. Very high quality minerals.
Yeah.
But then there's a lot of stuff that those companies, they have to go to China. China's the only source of these raw materials.
Source.
I mean, they've outpaced our manufacturing, unfortunately.
Right. Yeah.
And so third company involved.
Yes.
Talk about
that's where the third party comes in. Because you're essentially, as much as you can say, we're not biased, we just want what's best for everybody. Like you're always going to have some bias towards like your thing.
Sure.
Right.
Yeah.
So the third party comes in to say, we have no connection with party one, who's making the actual product. We have no connection with party two, who's supplying the source.
The raw materials.
So we're literally an independent, clear-minded, like we have no skin in the game here. So we're going to tell you the truth no matter what, right?
Yeah. And these are labs, typically.
These are labs,
high-end labs that do like spectrographic analysis.
Yes, so we'll do very detailed analysis to essentially ensure what these other parties say is right. Like, so if we're saying, hey, this is the purest, cleanest form of magnesium glycinate, then that independent third party is going to say, yep, you're telling the truth. Or, well, this you think it is, but we actually found that this batch is contaminated with lead or, or it's just not magnesium at all.
Well, I think like Natural Calm ran into that problem with one of their products. They weren't doing third party certificate or analysis. And then somebody took Natural Calm and then said, well, I'll pay to get it analyzed. And they found, I can't remember what it was a certain amount of heavy metal. And I think the company addressed it, but yeah, I mean, that's I think not only you want to make sure that it has what it says it has, but also in the amounts that it says it has. Right. So, I mean, I know for IFOS certification for fish oil, like you have to be over what you say. So if you say it has this much EPA, one of the omega-3s,
it has to be
at least that or more.
Yeah, it can't be just slightly below.
Yeah. And what a lot of people don't know is for generic drugs, they don't have to be
exact.
They can be 20% off the mark.
Yeah.
And so, for something that's dosed very precisely like thyroid, that could be the difference between two different doses. Yeah.
Yeah.
Okay. So we've got third party certificate.
So we kind of clarified that. Yeah. So like that.
So everything in our office, we could look at the lot number and call the company and say, give us the certificate of analysis on this lot.
And we have had times, remember, in the clinic where we are on back order of something because the company's like, hey, our this raw material for this product that you guys like, it did not pass the quality.
Right. Yeah, that happened a couple of times with some of our custom manufacturing.
Yeah.
What blew me away, so I took a tour of one of these facilities years ago in Florida, and they had a whole section of their manufacturing facility that was where they quarantine the raw material. So 55-gallon drums of vitamin D powder would come in. I mean, it's a massive amount of vitamin D powder. And that would be in a locked off section of their manufacturing facility, separate from everything else. And they were sending out aliquots of that for testing. And at the time they said, and I can't remember, it was hundreds of thousands of dollars of material that they would have to return.
Yeah.
In some cases they're returning it to China saying, we can't accept this. It failed our testing.
Yeah.
And I asked him at the time, I go, well, what does China do with that? Do they dispose of it? And they said, no. They turn around and sell it to somebody else.
Yeah, who doesn't through
do that third party. Because the reality is, not only is that time intensive for that company, it means it may send them back in their manufacturing process because there's supply issues involved with sending raw materials back.
Right.
But they are having to pay to have that testing done, right? Yeah. And it's not, obviously it's not required by the FDA. Yeah. And I would argue, I mean, if people think prescription drugs are so much better, go read Catherine Ebon's book, Bottle of Lies.
Yeah.
Fantastic book talking about the generic drug industry and how there's almost zero oversight. Those places almost never get audited.
Right.
And there's, I mean, there was something like one inspector for every 1,000 drugs that's produced.
Yeah.
And so they just know it's a numbers game.
Yeah. Yeah.
No one's ever going to check our work on this. So that third party certificate analysis, that is something that increases the cost of supplements. Yeah. Would you say?
Absolutely.
Yeah. But
absolutely. Yeah. But
that helps us know.
It keeps it safe.
We know we're not getting,
you know what you're getting,
mold in there. They're checking for, micro contamination like bacteria. They're checking for heavy metals.
You're getting an arguably like therapeutic dose of what you really need for something. So, because like you kind of referenced earlier, how frustrating is it where you're like taking this product, you're thinking you're supposed to get some result from it and you don't, and it's not, it's because it's not what it says it is.
Well, I think, I think you remember the whole green lipped muscle oil that was really popular back then. People were like, oh, this is really high quality fish oil. And, we would test omega-3s in the blood and we'd be like, omega-3s are really low. Oh, no, I take this stuff. They say it's the best ever. And then it was like a year later, it came out that they did a genetic analysis and they're like, whatever, this isn't from a green lipped muscle or wherever they say it's from.
Yeah.
And so, again, I think there's a lot of people in the industry that are trying to pull the wool over people's eyes. It's a difficult industry to be in because maybe the lack of of oversight.
Yeah.
But I would say it goes back to everything. Buyer beware.
Right.
Be a sophisticated buyer of supplements.
Right.
Right.
Yeah.
So what are some of the things that you tell patients to look for when they're looking at supplements to see, does the label look like it's a high quality supplement?
Yeah, I mean
the bioavailability is probably the most difficult thing for regular patients.
Right. Yeah. Especially with like we were kind of referencing earlier with different forms of certain nutrients, right? Where it's like there's several forms of vitamin B9 or like magnesium's another great example.
Oh, yeah.
Several forms of magnesium.
So that for me is a litmus test. Another litmus test is someone brings me a label and I look around and go, well, let's just look at it. So we look and we go, okay, folate as folic acid. That's ding number one. Not a great bioavailable form.
Right.
Magnesium as magnesium oxide
usually.
Right. So what is the magnesium oxide's 4% bioavailable?
Yeah. I always tell people, unless you're trying to treat constipation, maybe.
Great for loosening the bowels. Probably not getting significant levels into the body. So, I think you mentioned cyanocobalamin versus methylcobalamin. So those are some kind of easy things that people can do really quickly just to look. And then dyes. Remember when we tried to find a prenatal, we had a patient who was allergic to some like red food coloring, I think it was. Yeah. And
it used to be very difficult to find.
Well, yeah, she said I need to find a prenatal vitamin that isn't pink.
Yeah.
And so we called the pharmacist and we were like, hey, do you guys have a multivitamin that we can order that doesn't have any dye in it? And the pharmacist was like, oh yeah, I'm sure we can. And she goes, I'll call you back. And we got to call at the end of the day. And this pharmacist, poor girl, she's like, I'm pulling my hair out. There's nothing out there. They go, why are they putting shellac in this stuff? Yeah. I mean, it was like the curtains were pulled back for her, and she was like, there's all this crap.
Yeah. So forms, and that's usually a really big ding for me is when I see these supplements that have like artificial colors in them, and it's like, why? It doesn't need that at all.
Who cares what color your capsule is?
Yeah. Or just like, there's a ton of like polyethylene glycol and just, some of these ingredients so that's another thing you can look at. It's kind of like with food, right? Like when you're looking at a label, keep it as simple as possible. Some things, are difficult to totally avoid and arguably for most patients, I think are pretty inert. I sometimes get a bunch of questions about like magnesium stearate, and
that's a tough one.
It's a tough one because I do believe that some people maybe really notice a reaction to that. But for a lot of even our high-end, very reliable, good supplement companies, that's hard to avoid because it's really the machinery that needs that substance. So
that's a flowing agent.
So sometimes I try to, again, if I'm like, hey, if you really think it's this thing, okay, let's try something else. Because there are a few companies out there, like pure encapsulations and stuff like that, or even like there's some custom, formulating companies where they'll make stuff for you and they can really keep as many additives out as possible, like just a vegetable cellulose capsule, for example.
Well, and that brings up a great form. Like, so not only the form of the micronutrients, maybe the bioavailability, the dose, right? I mean, how much is in there? For me, the form, so tablet versus capsule, I still have this image that I took. I was doing a colonoscopy years ago, and I get to the cecum, which is sort of when you're done with the colonoscopy. So I've gone, rectum all the way around, transverse colon down into the cecum, and there's 2 1-a-day vitamin tablets that I can still read 1 a day stamped into it.
Oh my gosh.
And I have that picture somewhere on my iPad. Saved. Yeah. And, I had another patient who they live out in the country and they have a septic system. And so they're getting the septic system serviced, and, the guy comes out to service it. And as he's leaving, the guy mentions to the husband, he goes, "Well, you guys sure like to take vitamins, don't you?" And the husband goes, "Yeah, but
how do you know
do you know that?" And he goes, "Oh, come over here." So he opens up the septic tank, shines a flashlight in there, and the husband was like, there's just capsules the tablets just floating on the top of their in their septic tank. And so he was like, I'm literally flushing money
down the toilet.
And so, so that's another thing I learned in the manufacturing process is tablets are very, very inexpensive to produce because a tableting machine can just pack powder
it together.
And then, then people are like, well, it's hard to swallow. Oh, no problem. We'll put shellac on it.
Yeah. Yeah. So I will say there are some tablets. I mean, we even carry in the office a couple of tablets, but it doesn't they're specially designed. Oftentimes it's because we needed like something in the form of like a time release.
Well, niacin's a great example. Like if we're going to use niacin, we want it to release slowly. In fact, I'd be happy if a little bit of a niacin tablet was left by the time it got the colon, because putting something on really high immediate release niacin makes them feel lousy.
You might have more side effects and things like that. But ultimately, like you won't see shellac listed. Like you literally will see shellac listed.
Or it's a tablet that's meant to dissolve in your mouth. Or it's a tablet that you chew. I think those are acceptable. So I'm not saying like all tablets are bad. But it was shocking to see that.
Like you shouldn't see your tablet coming out in your stool.
Yeah. So, I mean, and one of the things that I remember on that third-party certificate analysis, one of the things they analyze is dissolution time. So they're actually looking to see in the pH of the stomach, how long does it take the capsule to break apart? And in, with those veggie caps you were saying, in most cases, those reports I've seen, it's 6 or 7 minutes.
Yeah.
So in 6 or 7 minutes, it's dissolved and absorbing into your body. So,
Yep.
So a lot of work goes in to make sure.
That's what we want for our patients. Like, we're not trying to say, oh, you got to only use ours. And I always tell people, I'm like, we are not married to any product.
No, in fact, we cycle products in and out based on, we find something that works a little better. We get better results with.
We get together at least once a year, if not twice a year, with the whole provider team and hash through the list of what we're carrying. And we're really intentional about it. So
I think that's the big one.
Those are the big ones.
So again, to summarize, I would say it's bioavailability, right form, right dose, right? That it's something that truly is best taken in a supplement form. I mean, again, I remember there was years ago, I think the same company that did the green lip muscle, they were doing butter oil capsules. Do you remember those?
Yes.
There was literally butter jammed into a capsule.
Yeah.
I'm like, hey, I don't know if you've tried butter before, but it's delicious. It's just eat butter.
And don't, this isn't like, grandma and grandpa telling you some story that's like never happened or like happened to so-and-so's twice removed third cousin's wife or whatever. Like I have patients who, thank God, weren't harmed, but that were contacted. And like one I'm thinking of in particular was contacted by Amazon.
Really?
So, I mean, that kind of brings up another no, I mean, if I'm being totally honest, I have like a love-hate relationship with Amazon, right? It's like, oh, so convenient sometimes.
So convenient. You want something, you pull your phone up.
But like, I think Amazon's one of the worst places you can buy supplements for several reasons. And I share this with my patients. We can share it now if you want.
Sure.
But
I think it's very important to learn because I think Amazon, again, is the largest retailer on the planet.
Yeah. Lots
of people shop on Amazon the same way you and I do.
Yes.
But why not supplements off of Amazon?
Yes. There's a handful of reasons. one, obviously, pretty much anybody can sell on Amazon.
Yeah.
Right. So lots of third, fourth, fifth, sixth party sellers, right? Where it's like they can just buy, bulk and then, modify the product to cheapen it or stretch it out or whatever. Or sometimes they just steal labels and marketing and slap it on a fake product. And
this happened to me. Actually, I was at a conference years ago. And I left my magnesium at home. Magnesium helps me sleep, especially when I'm away from home.
Yeah.
And I was in a city where Amazon same day delivery was available. Remember when same day was like a big deal? It wasn't like it was available in Dallas and a few markets. Yeah. And I was like, I'm going to try this. They'll bring it to the hotel. I'll have it in a couple hours. So I ordered a magnesium, and when I got it, I opened the bottle and I was like, this doesn't look like the magnesium capsule I have at home. I wonder if they've changed. Well, I have the rep's phone number for our product on my phone. So I snapped a picture of it and sent him a text. And I was like, hey, did you guys change magnesium? He goes, that's not our magnesium. And then I showed him the bottle. He goes, that looks like our bottle, but that is not our magnesium. And I was like, wow, they're very sophisticated. I mean, and this is one of those bottles that even had like an embossed edge to it. I mean, the label looked perfect.
It was a good fake.
It was a good fake.
It was a good fake, yeah.
And so, and you get it, like some of these, and a hard part, I think, for these businesses that do go a step above, right, that are known for the high quality third-party certificate. Once you're known for that, well, now you're a mark, right? People recognize that brand and go, I know that's a third-party high-quality brand. I've seen that at my doctor's office. Yeah. I can get it on Amazon. Oh, it's 25% off. Well, that's great. There's a sale on it. No way to know if that's the actual product, right?
Yeah. It's also hard. Amazon obviously has warehouses, all over the place. But, the question of like, is it temperature controlled? Like, is it, how's the humidity? Is your product seeing a bunch of heat or light or moisture?
Right. It's like 60 feet up in an Amazon warehouse on July.
That's like not controlled, right? I mean,
it's going to be 150 degrees up there.
Yeah. Yeah. So that can obviously, most times it's not necessarily going to like make the product poisonous, but it'll affect the quality, reduce usually the, efficacy of it. So, but I think the biggest one is my biggest concern is that you're going to get a fraudulent product and who knows what's in it. So, this happened to a patient of mine and thank God it didn't seem to be anything that like harmed her. But it wasn't what it said it was. And, and it really, to go back to kind of the regulation piece, it's like, the FDA does what it can, but like, it's just like, even with drugs, they can't monitor every single little thing. So with supplements, they really do rely pretty heavily on the public reporting a concern and then they go investigate it and find out. And, so again, it's your health is not worth a shortcut or a discount, and again, I still will work with people to try to find high quality products that work with their budget ultimately in the end. Yeah. And we try to obviously do that too in our clinic, right? We have good relationships with these companies. We buy a lot of our product in a large quantity, which helps us bring down the cost. So, we're trying to be really mindful of that with patients too, I think, anyways. Yeah.
And I think the other thing that I like is that when we have found, we obviously put our label on a lot of things. And, when we started that private labeling, it wasn't about trying to obscure where the product was come from. We'll tell anybody.
Oh, well, tell people all the time.
Who's the manufacturer? We're happy to tell them.
It's this product.
But it's really about letting our patients know this is something that we use enough and have seen the clinical efficacy. And like I said, we've done the review and we feel confident in the product, confident enough that we're ready to put our name on it, right? And I think that's, again, another thing that says we stand by it, we trust it.
Yeah, absolutely.
Which for me is really important.
Yep.
So, I think everybody wants to know, you get these guys like, what's your stack? What supplements should I take?
You want to know what I'm taking?
Well, you get, patients come in and they're like, I want you to look at my supplements and tell me if I'm taking the right stuff. Yeah. And I'm like, I don't know. Yeah. I kind of have my 4 favorite that I sort of stay on all the time. So I'm curious, what's Dr. Marvin's like, what's in your
my
repertoire? Now again, I'm not saying for treating an illness or disease or anything going on with your health. Basic. Just like what's your basic, like what you would say without knowing anything about the patient, adult female, what's a good thing for them to take?
Well, I'll clarify if I need to, but I mean, like for me personally, especially, like like you were saying, I'm a magnesium junkie.
Yeah.
Like if somebody said you got to go live on a deserted island and you can only take one supplement, what are you taking?
Magnesium.
I'm definitely taking magnesium for sure. It just does so many wonderful things in the body. It affects hundreds and hundreds of different enzymatic pathways. But for women especially, I mean, it goes all the way from supporting the nervous system and helping with sleep, all the way to your gut and your liver and metabolizing hormones like estrogen. I mean, it really is an amazing nutrient.
So are you using...
So I take a ton of magnesium.
So not magnesium oxide.
No, definitely not that.
What's your favorite form?
My favorite form is magnesium glycinate. The glycine, it's the amino acid glycine. And again, it's just such a calming, like good amino acid for the nervous system. And it's pretty gentle on the gut. So most people can tolerate those higher doses that a lot of people arguably really need without it causing like loose stools or that type of thing.
Yeah.
So that's my favorite. But
mine I think would be the glycinate malate combo, just because the malate's a little more supportive for the muscles.
Sure.
So hard workout.
Yeah.
You're getting some, especially when Kirk's got me in a neuro program. Where
you're like need to bathe in magnesium.
Yeah, exactly. Okay, so you got magnesium.
Definitely magnesium, 100% all the way. I would say, well, I mean, gosh, my brain was like, I was like, oh, I'll tell you what I'm taking. But if I like have to think generally, I mean, people really can overall benefit from like a high quality multivitamin.
Sure.
Just because like our conversation earlier, as much as, and you and I, living the way we do and where we live and trying to grow our own food and stuff like that. I mean, but ultimately, at the end of the day, the soil's depleted, things are different. And sometimes just our modern day of living, our demands are higher too, right? It's kind of a combination of those things. So I do think, sometimes I kind of view it as like a little bit of a good insurance policy of sorts, where it's like, at the end of the day, I'm still prioritizing food. Like I definitely don't cheat my diet thinking, oh, it'll be fine because I take a multi.
Right.
I essentially take the multi to be like, I really did the best I could with my diet. I'm just kind of like shoring up a few things here. You know what I mean?
For me, it's like filling in the cracks in the bricks, right?
Yeah,
so little grout around the edges just to make sure there's a couple days I didn't eat well, or maybe I was stressed out. At least I've got the multivitamin covering that. So
and then
I think that's uncontroversial.
It's like as much as I would love to just naturally get my vitamin D 100% of the time. First of all, I don't live in a place where I could arguably do that year round. And so I do think vitamin D is definitely another one of those supplements that just because of all the benefits, anything from your immune system to your brain to your bones, and I guess with vitamin D, we should add in the other vitamin K, in the form of K2, because it's K1 and K2.
Or sometimes it's MK7 or mequinone.
Yes, exactly. And so I think, those two kind of go together essentially. So let's see. I mean, I also personally, I'd say those are like the main nutrients that I take. I do, a couple times a week, take a big old swig of cod liver oil. I try to eat fish, but again, where we live in Kansas, we're landlocked. We don't get the best like fresh fish availability.
Right.
So still try to eat fish a couple times a week, but I find that if I top it off with a little cod liver oil supplementation, my omega levels are amazing. Yeah. And don't even have to technically supplement every day.
And cod liver would be really important for a growing child. It's a little higher in the DHA than the EPA or breastfeeding mom.
Sure.
Cod liver would be good.
Yep. And again, so there's obviously several different forms, I think, of good fish oil or omega-3 supplementation. I just personally like the cod liver. I just, it helps cut back on like capsule count, it's just a liquid. Yeah. So that's kind of another, I'm kind of keeping it more nutrient based, but I personally also take adaptogens. I'm a working mom. I've got a farm and kids and, all the things.
A husband.
Husband too. We just had our 15th wedding anniversary yesterday.
Oh, happy anniversary.
But so adaptogens, those are typically, I prefer,
so you like maca,
I use ashwagandha, just to help support just those general stress responses. And I feel like, overall it just kind of helps me feel a little more resilient, helps with sleep. These are all things it's even documented showing can be beneficial for. But
we use that term adaptogen. I don't think we've really defined.
Yeah. I mean,
So
essentially what it means is that it like helps those systems in your body adapt to stress.
The way I've heard it described is specifically when it comes to cortisol, it's almost like a buffer. You think in a scientific equation.
Kind of helps you like get that what we would expect just physiologically, right?
Too acidic, a buffer will bring you down. If you're too basic, a buffer will bring you up.
Yeah.
Probably those adaptogens work similar.
Yep. And then I take a little bit of vitamin C, not all the time, every day, but sometimes I have seasons where I'm just like, feel like I'm run down, need a little more immune support, still help support the adrenals, stuff like that. So
kids are getting sick.
Yeah. Kids might be exposed to stuff
Staff
or
are dropping right and left around you. You're going to hit that zinc a little harder.
Like, I'm like, just shoot it straight in, know?
Yeah.
And then, another one that we carry, I really like, this is more from like kind of more of a female hormone perspective, is Ester Protect. It's essentially a concentrated DIM, which stands for diindolylmethane, really helps the liver metabolize estrogen. And, despite it's like I have a pretty healthy diet, I'm eating foods that help do that. There's just things in the environment that we get exposed to that we don't have a lot of control over that are endocrine disruptors, stuff like that. So, those types of things are really helpful. Yeah. I don't know. What about you? Like, what are your daily go-tos?
I kind of talk about the big three, which would be multivitamin, D3 and fish oil. Those are kind of my big three that I take. And I would say I've now changed that to the big four, creatine. Creatine, I don't know. I really feel like it's more than just hype like that.
Sure.
That double dose of creatine.
Yeah.
I've noticed that's helped with just mental clarity, word finding.
Yep.
There is obviously the benefit in the gym with lifting.
Sure.
You find that you hydrate the muscle a little bit better.
Yep.
Hydrated muscle is going to be a bigger lever. Bigger levels are going to move more weight. But the brain benefit of creatine's been surprising.
Pretty good.
Yeah.
Nice.
Been really good. So those are kind of my four that I feel like I take all the time. And then I'm like you, zinc, vitamin C, I have those on standby. And then, I've got some things I'm trying to push around with my lipid panel. So I take NAC, try to get my LP(a) down. I'm taking additional CoQ10, even though my CoQ10 level is pretty normal. I just feel like that's one of those. It's just a great antioxidant.
Yeah, for sure. Have you chewed any niacin lately?
No. Yeah, I did that once. And man, I thought, what in the world is going on?
I'm like, you look sunburnt.
Yeah, I think I can't remember.
Like, did you hit the tanning bed this morning?
Well, I think I had like a DGL chewable, and then I had the niacin, which is supposed to be slow release.
Yeah, you got your tablets mixed up.
Yeah, I swallowed the DGL chewable and chewed the niacin. I remember chewing it thinking, this one feels like stale.
Yeah.
Like it just was a little bit too chewy.
Yeah.
And I walked into the office and it hit. And I was just, people were looking at me like, what is wrong with you? I'm just bright red from head to toe.
Oh, one of my favorite that thankfully I don't have to use too often, but it's just, I love it. It maybe would just be up there with like, it's nice to have in a pinch.
Yeah.
Is the oregano oil that we're carrying.
Yeah, you
now.
love oregano
I
oil.
love that because when you just need something for, maybe and I'm not talking like your leg is rotting and falling off your body. I'm not talking about like I'm not even talking about like, maybe a UTI that can obviously develop into like a full-blown kidney infection. Okay.
Sure.
I'm not talking about like life-threatening infections here, but for
like a little sore throat.
Yeah, but like viral or even like acute sinusitis that's not complicated.
Yeah.
I have seen that clear things up in days, like a few days.
So you're using it as an antimicrobial.
So I'm using it as a general antimicrobial. And of course, I use it for a number of like just chronic complex gut conditions and stuff like that. But I will tell you, like a few years back, my husband had just acute sinus infection. Thankfully, he doesn't, it's not like he deals with chronic allergies or anything like that. But he was blowing out blood. Like it was getting a little serious.
Pretty bad.
Probably because he didn't start like some of the support when I told him to. But we'll leave that part, off.
A man that doesn't listen to what his wife says.
I know,
I don't believe it.
Shocker. But I just look. Finally, it got when he's like blowing out blood in the tissue. He's like, okay, what do you want me to take? And I'm like, you got to hammer some oregano, or you got to maybe do an antibiotic. And he's like, well, I don't really want to do an antibiotic, so. Hammered some oregano, 36 hours later, it was totally gone.
Well, and what's great about that approach is, again, people aren't dying from sinusitis.
Right. Yeah.
Yes, it can get complicated and it can get serious, but it's very rare.
Right.
And so, if the oregano doesn't work, all right, you got to get on some amoxicillin maybe. But as oregano does work.
Yes.
Now you haven't blown out your biome, and reset what's going on
that's something
there.
we could probably make a decent argument for too, is that, trying to be more proactive and supplements sometimes can help you do that to a certain extent, right? Before something becomes a bigger problem.
Yeah. Like sometimes when we're, taught to use antibiotics, we tell people, well, wait until it really gets to the point where we know that it's bacterial. Yeah. Whereas with oregano, you can say, the first sign of your sinus headache, take a little oregano.
Right. Along with, there's lots of other good immune supportive tools that we use to where, and sometimes it's like the argument isn't that you're just trying to do something naturally. It's like a lot of this stuff, arguably when done appropriately, ideally under the guide of somebody like you and me, is, I think, arguably lower risk in a lot of cases too.
Well, yeah. How many overdoses are there on vitamins in the United States per year?
Yeah. I mean, and if it's anything, it's coming from a crappy children's chewable because it tasted,
tasted good.
The kid, it was like sweet.
Ate too many iron,
exactly. And it was like
or something
iron.
like that.
Right.
Yeah, so almost none.
Almost none.
Yeah, right. I mean, we can be very confident that we're not going to overdose somebody on this. But
but and even like vitamin D, maybe that's another good example, right? Of like, yes, there are some fat soluble nutrients that you need to be mindful of, but
don't you think? I don't know. I think vitamin D changed for me when I had that patient very early in our practice. And I was afraid that I was going to be known as a guy that killed somebody with vitamin D. And I've told the story many times, but there's a patient who took a liquid vitamin D, which is 1,000 IUs per drop.
Per drop, not dropper.
Yeah. So we're talking normal dose would be 5 drops a day.
Yeah.
And she just decided she was going to drink the whole bottle. And it's like, 150,000 drops in there? I don't even know how much, but
a lot of vitamin D.
A lot of vitamin D. And I came in and we checked her level and it was like something like 300.
Yeah. But like calcium was totally normal.
Parathyroid hormone, calcium. We checked all electrolytes. I asked her, how does she feel? She goes, I had a little headache yesterday, but I feel fine today. Yeah. And so I'm like, okay, so there's no sign of toxicity, nausea, vomiting, headache. Those are signs of toxicity. No signs of toxicity. I told her, okay, don't take any more vitamin D. Yeah. I almost felt like telling her, don't go out in the sun. I didn't know.
Yeah.
And so we just watched her vitamin D slowly fall back over time. Right. And what was remarkable is I remember she had Hashimoto's. And again, I'm saying this disclaimer, this is not a way I would treat Hashimoto's.
Yeah, it was not like a treatment.
But like the next time we checked her antibodies, they were lower. Yeah. Now, did the vitamin D do it? I don't know.
Well, that's the thing though. Like if we want to reference back to like, there's studies that show that like some of those nutrients like vitamin D,
they definitely help with the immune system.
Yes.
Yeah. So I've wondered, okay, we call it a fat soluble, micronutrient that we think you can get toxic, but even vitamin A, I mean, you and I have used massive doses of vitamin A and ever seen.
Yeah.
So I wonder, do we need to reframe vitamin D as not a vitamin, but hormone D?
Oh, totally.
Right. Because the definition of a hormone is something that's made in one tissue and used in another. Well, we make vitamin D in our skin and use it all over our body. So I feel like that one probably shouldn't even be considered a vitamin necessarily, because vitamin technically is something you can't manufacture on your own. We make vitamin D.
We make vitamin D.
Yeah.
Right.
So
yeah. So I think it's just a good reminder where it's like, okay, we probably don't need to have like some unhealthy level of fear here with some of this stuff, but you do need to have a good understanding. And again, ideally, it's helpful and arguably safer to a certain extent to have somebody like you and me be able to give feedback and guidance on dosing and how you want to use something, how long you want to use something, and make sure you're not covering up something else ultimately, right?
I also tell patients, the ones that are somewhat skeptical about using supplements, I tell them, most drugs that we use today were based off of plant derivatives.
Yeah.
I mean,
statins are a great example, right?
Statins are a great example. And we use red yeast rice in our practice to help people lower cholesterol. Well, red yeast rice is a natural HMD-CoA reductase. So, and can be, very effective in lowering cholesterol. I mean, there's I think of the things, we have some things that we use commonly, like, someone with acute diarrhea. We found that using high dose probiotics is
can be super
effective.
helpful sometimes.
So women who are having problems, I mean, one of probably the supplement that we see used the most is our Fem Balance. That product has been amazing for people who are perimenopausal, postmenopausal on hormones, whether you're on birth control, whether you're having dysmenorrhea, painful periods, to the point where we had, when we first had that product, we had that manufacturing problem. couldn't get it. We would win women who were in tears because we ran out of it. And I've never had anybody cry when we run out of fish oil.
Yeah.
Right? Nobody cries when we run out of vitamin D.
Yeah.
We had husbands that would come in and say, I need to buy this by the case because I don't want my wife and 3 daughters to ever run out of FemBalance. So, I mean, I think there's been some products that we've found would be really tough to do what we do on a daily basis without them, right? They're tools that I think we find very helpful.
Yeah. For sure.
But yeah, I think there's a lot of nuance in that.
If I was just going to say anything about a supplement is that, it shouldn't really be the first go-to for a lot of things. And it's definitely not a fix-all for everything, right? It's like, it really is just a tool, an option as a tool to support.
Sure. It's a piece of the puzzle.
Something that maybe you're trying to optimize or help or whatever, Yeah. But I really try. And I think as a clinic and as a team, we try really hard not to just be, like I said earlier, that term green allopathy,
right?
Or just pill for problem, but we're just using supplements. Yeah. And I encourage patients to, because again, understandably, people come in with that expectation. They're just like, as an easy example would be like, I have high blood pressure and I don't want to take high blood pressure medication. Yeah. What's a natural alternative? I'm like, well, here's why it's not always good to like think of it that way, because ultimately you want to try to look at a problem, figure out why it's a problem. Yeah.
Are they overweight? Do they have sleep apnea?
Exactly.
But once you've gone through those things, I mean, for me, blood pressure, at least one of the big ones I use is magnesium. I mean, going back to it's a smooth muscle relaxant.
Yeah, like that can be part of your process of figuring out the problem. I mean, is part of the problem because you're lacking a certain nutrient? Yeah. Sometimes it can be. Right. But still want to be very intentional about not just being like, well, this is better because it's a natural, it's supplement.
Because hemlock is natural, and that didn't work out so well for Socrates.
Yeah. So,
okay. So is there anything else? I feel like we've touched all the points. Is there anything else you can think of that we need to?
I don't think so. I mean, again, just.
So know where your supplements are coming from.
Yeah, make sure they're coming from.
They're good bioavailable micronutrients.
Yeah.
There's some third-party certificate of analysis behind that.
Right. Right.
Supplements are not created equal. I mean, I think that's the biggest thing is like just that one step of saying, does it, when patients say, well, I know this one's really good. I go call the company.
Yeah. And ask.
Tell them, here's a lot number. Can you send me the certificate of analysis? And either they'll say, no, we're not required to do that. Or they'll say, yes, we do that, but we don't release it to the public. Yeah. Okay. That for me is a big red flag. Or yes, we're happy to supply that for you. What's your email? Right? Yeah. So that's a very simple way. I feel like you can cut across the supplement industry, and probably 97% of supplements don't pass just that one test. Right. So that's probably the easiest way to do it. It requires a little more work. But you really that's what we have to do.
You really do get what you pay for. I
would agree.
Yeah.
Yeah. Like most things in life.
That is true. Okay.
Thank you very much for wrapping up episode 12.
Awesome.
Thanks, guys.